Hi, I'm Steven. You can now watch UCF TV 24 hours a day on Bright House Digital Channel 1.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello and welcome to Public Affairs Today. I'm Alicia Callanan Mandigo. This is a show designed to introduce you to public affairs, which is a much more dynamic field than you may realize. On the table today, community partnerships. Joining me today is Dr. Nancy Ellis, who is the director for the Center for Community Partnerships at UCF. Welcome and thanks for joining us today.
Thank you, Alicia.
So that phrase, community partnerships, it was new to me. It's probably new to a lot of people, and it's a rather broad sounding phrase. So when we talk about community partnerships, we're talking about community services, things like healthcare, social services. I'm sure there are others. So why don't you start out by telling us a bit about what this all means?
Well, community services comprise most of the services that we receive in the public sector. So we're talking about government services, we're talking about the thousands of nonprofit organizations that are out there providing social services and healthcare services and everything in between. So what we're really talking about is the organizations whose sole purpose is to improve the quality of life of people in our community.
Okay, so the Center for Community Partnerships at UCF is roughly 8 years old, which means that it has a good footing already in our community. Tell us a little bit about how it came about and what its specific purpose is.
Well, I think one of the unique pieces about the Center for Community Partnerships is it was actually an idea that was developed in the community. Mm-hmm. The Winter Park Health Foundation, Debbie Watson, who is vice president with the Winter Park Health Foundation, got together with Maureen Kurzmarki with Florida Hospital and the Community Health Improvement Council, the CHIC board, to discuss ways in which they might be able to partner with the university to provide access to greater expertise in evaluation, analysis, access to data that would help the community in solving community problems. So the wonderful thing is that the community and the university came together, in this instance the College of Health and Public Affairs, to put together a center that could really act as the focal point of partnership efforts between the college and the community, with the goal being to really provide support to the community in solving major community problems and issues.
For instance, if you could explain one problem that was identified.
I don't actually know what a specific incidence was at that given point in time, mm-hmm. But what I can do is use a current example of a partnership effort that we have going on currently. Okay. In fact, I can actually point to a number of partnerships that we're involved in to really make a difference in the community. One of the critical current partnerships that we have going on is a partnership with the State Attorney's Office. Lawson Lamar identified an issue that his staff and administrators were seeing in the juvenile justice system. They were very concerned about the fact that in the more severe crimes, mm-hmm. the quality of the severity and the types of actions and behaviors that were occurring were very concerning.
Now, wait,
really
are these crimes that are being committed
by
by the
juveniles.
juveniles? Okay.
So the worst crimes were actually worse than they had been. The kinds of behaviors, the unprecipitated or unprovoked acts were of a great concern to them. So that they came to the College of Health and Public Affairs and asked if we could work together as a team to really begin to look at, one, to check is what they think they're seeing, what they're really seeing, and then to begin to make recommendations on what to do about that. And we're in the process of this teamwork. We've completed 2 phases of a study that we're doing for them, looking at the incidence of juvenile crime over 10 years, then looking at the information about the more severe crimes and what's happening when those crimes are committed. And then we're actually entering into phase 3 of the project, where we're going to be looking at what happens to the juveniles that commit crimes in their lives, in their communities. Why do they take the paths they take? And what kinds of policy recommendations and program recommendations, once we gather all of that information and analyze it, we be recommending in conjunction with the State Attorney's Office to really hopefully impact the community by making recommendations in developing prevention type programming for juveniles that might really have an impact over time. That's just one partnership. We're working with Ray Larson, the Executive Director for the Central Florida Commission on Homelessness, providing student staff support to the various subcommittees that they have going to help support this initiative that is really looking at homelessness in Central Florida and how to address it. And they have a whole initiative called End in 10, where the goal is to end homelessness in the community. When you look at homelessness, what you realize is the people who are homeless have a variety of issues they're addressing. It's not just not being in a house. And so it becomes very complex. One of the things that we're able to do, whether it's in working with the State Attorney's Office, or it's working with Ray Larson, or it's working with Joan Nelson and Bob Brown in their Community Impact Initiative and trying to support in any way that we can, is that we can bring a diverse group of educational professionals and strong researchers from criminal justice and legal studies, from social work, from public administration, from health administration, and we have a whole new program going on now in health management and informatics. We can bring faculty in from the communication sciences and disorders program to work with literacy in some of our preschool initiatives and some of the things going on in the community, so that it positions us so that we can build ongoing partnerships, not just project by project by project, although we do that, but build ongoing partnerships with various organizations in the community. And in that process, we have the ability, because of the diversity of our faculty and students, to really begin to examine, evaluate, bring our expertise to the table, and together really begin to solve some of the larger issues facing our community. And it's that true interdisciplinary nature of our college and the variety of disciplines and the expertise and the perspectives that come together that provide us with a unique ability to make a difference. And in the end, what the Center for Community Partnerships is all about is bringing the expertise of our faculty and our students. We have some phenomenal students in our doctoral program in public affairs and in our master's programs. And we can use the strengths of those individuals in conjunction with all of the faculty to really sit down with our community partners and really take a look at the issues from multiple perspectives, design research and evaluation and procedures and studies that can help inform the decision-making process, and then sit at the table with them and really hopefully together come up with some systemic solutions that in the end will genuinely make a difference in our community. And part of my role is then to go out and meet with all of the different leaders in our community, whether they be from the public sector or the private sector, and really make those connections, educate them about what we can do and the partnership efforts that we're willing to invest in, and really begin to make those connections on the community side as well as on the university side. And by the way, we have a new dean in the College of Health and Public Affairs, Mike Frumpkin, who is all about community partnerships. So he is having a tremendous impact already in his short tenure in building some very strong long-term partnerships in the community so that we can really work together on making a difference. And when you tie this all together with President Hitt's community partnership priority, it just all makes sense. So I have to say it's really satisfying, and it is a wonderful place to be at this point in time.
Let's go back to one of the examples that you cited, which is the problem with homelessness. And you said you've launched a new campaign, End in 10, I believe you called it?
Well, we didn't launch the campaign. There was initiated with community leaders, the City of Orlando, Orange County government, to put together a commission on homelessness. That commission's there's a big commission report that has been printed from a year's worth of analysis and study. That commission appointed Ray Larson as executive director to work with them on some very targeted community areas. And you can go on the website for the Central Florida Commission on Homelessness, and you can see all of the priorities listed and the subgroups that they have identified. And what we've been able to do is work with Ray on providing student staff support to the various committees that are looking at housing, they're looking at transportation, they're looking at health care, they're looking at joblessness, all of the issues that impact when someone becomes homeless. It's the end result, it's the symptom of what's going on in their lives. And so a goal of the commission is really begin from a systemic perspective to really look at what are the contributing factors to homelessness and how do we begin to address those issues long before people are homeless. So
okay, so I'm going to hit you with two questions here.
Okay.
The first is ending homelessness in our area within 10 years a viable goal? And how do public attitudes play into that effort to end homelessness? Because when you speak to random people about the issue of homelessness, you get a lot of, oh, people are homeless because they choose to be living in the street. That's the way they want to live. They just don't want to be part of society. They cast a lot of blame on the homeless person himself for being homeless. So do those larger public attitudes have to be addressed as part of what you're doing in terms of finding solutions?
Absolutely, and I think one of the other partnership efforts that we have in place in working with Ray Larson is to really try to provide the opportunity to research some of the major issues in our community as they relate to homelessness. I think attitude is everything and perception is everything, and I think that as we continue in this recession, almost of its own, as a result of what we're all facing together, people are going to become increasingly aware of why individuals and families reach the point of homelessness. We have so many issues facing us in the healthcare industry. Healthcare alone, the uninsured and the underinsured can truly affect families with regard to whether or not they're able to maintain stable housing. I am not the expert in this. The best person to go to would be Ray Larson, the executive director for the Central Florida Commission on Homelessness. But what I can say is this, is that the effort is being made by people who really understand the process to create changes in our community systemically that will have an impact on everyone. The fact is that contributors to homelessness are the same kinds of issues that face every family, just at varying degrees of intensity. And what is most unique about this is we're bringing together the resources of the College of Health and Public Affairs and the resources of the community and the expertise and experiences of both, because if you're really going to solve a problem in the community, you need to go to the community and get their take on exactly how that problem manifests. Mm-hmm. So when we're looking at partnerships, it's equal footing, working together to make the difference. And part of it is our ability from the college perspective to really respect the knowledge, the experience, and the expertise of those with whom we work in the community. And in addition to that, to be able to communicate effectively to those partners the knowledge and the skills and the expertise of the faculty and students within the College of Health and Public Affairs. And the uniqueness of this is the multidisciplinary ability that we have to work across disciplines in the public sector, whether you're working with law enforcement, whether you're working with healthcare, whether you're working with social services. They all intersect. In fact, one of the reasons I am a graduate of the doctoral program in public affairs, and one of the reasons I pursued that degree, although my background primarily is in social work, I've been in government administration, I've been in healthcare, nonprofit administration, and I have been a clinical social worker managing clinical programs in the community. So I've continuously worked with the juvenile justice system, with the State Department of Children and Families, with the hospitals around issues of health care and the uninsured. So it just seemed a natural fit for me to then become a student in the doctoral program in public affairs. But how that translates through the Center for Community Partnerships is folks can come to me, call me, email me, I go out and meet with them individually and say we need help with a situation, or could we partner with you on something, or we could really use a student to really help us if we're a nonprofit. Maybe some of the nonprofit students in the nonprofit management master's degree program, we could really use help with developing a strategic plan in our agency, and we can place those students with those agencies to help out. Or if they need faculty expertise to do independent evaluations of their programs as they seek funding and want to enhance their services, we can also provide those project-by-project skills, which are really critical to the community. It's becoming increasingly apparent to the various organizations in the community that the need for an independent broker, someone who can step in, who's neutral, who is willing to come in and evaluate processes and service delivery and the kinds of programs that could be most beneficial in a very neutral, unbiased way, is critical to organizations assessing their programs and their efficacy, and also it's critical in seeking funding to provide ongoing support for services in the community. And this will only become more important. So we're able through the center to connect the community and the college in a way that provides multiple access points and service opportunities. So it's really satisfying.
So the center not only benefits the community, but it also provides a number of opportunities for both the faculty and the graduate students who are working through it. I want to switch for a moment to the issue of health care. You had provided a study to me talking about children's health care, and there were a couple of points in the study that I found particularly interesting. One of them is that it states that we, for many years, were improving children's health. We were on, upward scale there. But now, in recent years, we've at least plateaued. We have perhaps done a backslide in terms of children's health care. Some of the things mentioned are asthma, obesity, preventable injuries. I was really surprised to see that there is concern we have done a backslide. So if you could just talk a little bit about this study and what it means.
I would be happy to. Let me provide a frame, because the study you're referring to is a hallmark study that University of Central is involved in a consortium being led by the University of Miami. Orange County will be a study site for a 20-year study of beginning prenatally, of a trend study for children, and it will analyze all kinds of biological and environmental factors affecting children's health. This National Children's Study requires an internal partnership between the College of Medicine and the College of Health and Public Affairs. And externally with our community partners, with the health department, with Orange County, with a variety of healthcare providers in the community to actually make this or move this study forward. In fact, one of the things we're currently doing, which pulls in our community partners, is we have put together a scientific advisory board and we've put together a community advisory board. The actual sampling doesn't begin on the study until a year from now. But currently, we have already put together the community advisory board and have meetings scheduled, because the community, the folks from the community that will be working with us on this study are the ones that will help us identify where we do the sampling, getting the mothers and the children that will be participating in this study. One of the things that the study points out is that children's health overall has been declining, and that is for a variety of reasons. There are many children, particularly who are economically challenged, that do not have access to appropriate preventative and primary health care. The obesity trend in the United States has been growing at a dramatic rate for all age groups, but one of the age groups we're most concerned about is our children. And because of the growth rate in the number of children who are significantly obese, is having such an impact on their health that that has become a great issue. And we have community partners out there that are working, trying to bring together community efforts to really begin to address childhood obesity. The Winter Park Health Foundation is involved in that. The Health Council for East Central Florida is involved in that. In fact, they are just in the process of putting together a consortium to specifically focus on childhood obesity in Central Florida. Nemours is involved in it. All of the hospitals are involved in it. So the fact is that our children, as they become less and less healthy, less physical activity, higher fat and higher caloric foods with less nutritional content, they're beginning to experience many of the diseases that we always connected with aging,
Right.
such as diabetes, high blood pressure, and heart disease, many more. I mean, it's very frightening. And so, again, the community is coming together to really begin to look at what we need to do in Central Florida to really affect what's happening to our children in that area. So I'm very excited that I get to participate in some of that as a part of the community efforts.
That's really interesting. This is a fascinating study. It's going to be fascinating to watch how it develops, and I'm particularly interested to see so many Florida universities involved in it. I haven't seen that before. Unfortunately, we're out of time. Hopefully we can have you back and do some follow-up on some of these topics that we've discussed.
I would love to do that.
Yes, because we always run out of time. There's always more to talk about. So, but we do want to thank you for joining us. Again, we've been talking with Dr. Nancy Ellis, and she is the Director for the Center for Community Partnerships at UCF. And that's it for now. I'm Alicia Callanan Mandigo. Thanks for watching Public Affairs Today.